Hello, and welcome to my presentation on exploring TSH, which is a hormone in our endocrine system. So today I will give you an introduction of TSH, how TSH works, a small introduction on T3 and T4, which are other important hormones, the TSH feedback loop, some clinical correlations, some take-home points, and then we'll finish up with some practice questions. Okay, so what is TSH? TSH is also known as the thyroid stimulating hormone. It's a hormone that is produced in our anterior pituitary gland. The function of TSH is exactly like it sounds. It stimulates and regulates the production of other thyroid hormones. TSH levels are inversely related to those thyroid hormones. And then when testing your TSH, normal levels are usually between 0.4 and 4. So how TSH works? First off, it's released by the hypothalamus. Oh, my little video there. Okay, so the hypothalamus releases the thyrotropin releasing hormone, which then travels down to the anterior posterior, and that stimulates everything to respond and produces and releases the TSH into the bloodstream. So from there, it's going to travel through our bloodstream down to our thyroid and bind onto the follicular cells where it will transport iodine ions, which are needed for the secretion of our T3 and T4 hormones from the thyroid gland. So why are T3 and T4 important? Well, when we're talking about just the TSH, it doesn't do a whole lot, but it does because it stimulates the production of T3 and T4, and those do a lot. So T4 is going to be our most prominent of the thyroid hormones, and it is going to be about 80 to 90% of what's in there, and have a half-life of about 7 days. T3 is derived from a conversion of the T4, and it's a lot more active. It's kind of what makes things happen, and it has a half-life of 1 day. So what will happen when it's active? It's going to help by regulating our metabolism, regulating our heart rate, regulating our body temperature, and then it's going to be helping maintain our muscle strength, our brain function, our digestive system, and our bone health. So these two hormones actually play a huge role. And if our TSH is not on par, you might see some different side effects going forward. So how does this all look together? So this all forms a negative feedback loop. So you're going to see that you start in the hypothalamus where the TRH is produced. It travels down to the anterior pituitary gland. Then the TSH is going to travel all the way to the thyroid gland. It's going to attach to the follicular cells, past the iodine levels across where the T3 or the T4 will be able to bind with those iodine levels, and then they can go on and do what they need to do. So as the T3 and T4 are traveling through the bloodstream, they all go back and relay the messages to the pituitary gland and the hypothalamus. And then depending on what those levels are, TRH and TSH will either increase or decrease, causing the negative feedback loop. Okay, so what does this tell us? What do TSH levels tell us? Why is this clinically important to us? There's a few different things. One thing that can happen is your body can decide to not produce enough TSH, which is what's mainly tested when we're checking our thyroid levels, or your body can produce too much TSH. So what we call the first, where your body is not producing enough, is called hypothyroidism. Causes of hypothyroidism are generally autoimmune disorders, iodine deficiency, damage to the, oh my gosh, my little notes, they're all covered up by my things. Thyroiditis, which is inflammation, and then radiation therapy are also causes of this. So symptoms of hypothyroidism are a TSH, that's your blood test, that's going to come up at 4 or higher. Your body will start to slow down. You might feel colder. You might tire easily. Your skin will get dry. You might have brain fog, depressed, or constipation. Anything that you can think of as slowing down in your body, that could be a sign of hypothyroidism. Just think things slow down. Generally, the treatment for hypothyroidism is a medication that will increase your levels of T4 and should then kind of make everything so if you like back to normal. So if you look at the graph here, you can see where the relationship between that TSH and T4 come into play for both the hypothyroidism and hyperthyroidism, which we will take a look at now. So hyperthyroidism is the exact opposite of hypothyroidism. Again, it can be caused by an autoimmune disorder, thyroiditis, different medications, and some symptoms that you're going to be looking for are your TSH levels below a 0.4. You might have trouble sleeping, weight loss for no reason, trouble tolerating heat, nervousness, increased heart rate, more frequent bowel movements, and then the only physical sign of something that has to do with your thyroid is what they call a goiter, which is just an inflammation of an excess of thyroglobin cells, which you will see in my other presentation on the thyroid. So treatment for hyperthyroidism, again, is going to be medication, radiation therapy, and then possibly surgery, depending on if you get to that goiter point. All right, so some key points to take away today are that the hormone TSH regulates thyroid hormone production, impacting nearly every process in our bodies. TSH is controlled by the negative feedback loop involving T3, T4, and TRH. Abnormal levels are pivotal in diagnosing our thyroid diseases. So think anything below 0.4 or above 4 is generally where you're going to want to really talk to your doctor to find out what's going on. So some fun questions that I have are kind of like some fill in some blanks. So the first one is TSH is a blank feedback loop with blank. So the answers would be TSH is in a negative feedback loop with T3 and T4. You can also add TRH in that as well. Our next question is, a female with a TSH of 0.25 experiencing increased heart rate, rapid weight loss without changing lifestyle, and anxiety may be experiencing, answer is hyperthyroidism. And that's where your body is just burning through it so quickly and it cannot keep up. All right, our last question is going to be, what is needed for TSH to stimulate the T3 and T4 production? And the element needed for that is iodine. So that is the end of my video today. I hope you enjoy it. Make sure you check out my next video coming up in our lab, which will be covering the thyroid.